Okay, so I'm going to start by washing my hand before I go see the patient. I'm going to wash for 15 seconds. Okay. Knock, knock.
Hello.
Hello, hi, my name is Liz. I'm one of the nurse practitioners here. What's your name?
Tolson.
Tilson, how may I help you today?
I'm here for annual physicals.
Your annual physical. Okay, can you please tell me where you are?
Long Island University.
And what did you have for breakfast this morning?
I had a toasted bagel.
And what's your date of birth?
5/16/1985.
Okay, very good. Patient is alert-oriented. Speech is coherent and clear. I'm going to give you 3 words, and I want you to remember at the end of the assessment, I'm going to ask you, okay? Red, yellow, green.
Okay.
All right. So the assessment includes some examination of the whole body. It's going to include some me assessing parts of your body. Okay? All right. So I'm going to start with the skin. I'm looking at the face. She's got makeup on, but I do see some papules. Other than that, the skin is light brown and it's even. Gonna go ahead and same for the arms. So the arms are warm to touch. Feels smooth and dry. Elastic recoil, less than 3 seconds. Good skin turgor. So I'm looking at the skin of the nails. I don't see any blue discoloration in the webs as well. The nail beds are pink, and as I press, it's less than 3 seconds. All right, the palms I'm looking, and it's pink. All right, very good. So I'm looking at your face, and your eyebrows are even and symmetrical. Can you please shrug your eyebrows to me? Okay, they move voluntarily. Okay, so now I'm gonna go ahead and start with your head. I see her hair. She's got evenly distributed hair. Is this your natural hair?
No.
Okay, I'm gonna go ahead anyway and see if I can look at the scalp. All right, I'm able to still see the scalp. I don't see any scaliness. I don't see any dandruff. Okay. I don't see any kneading. Gonna go ahead and feel. Does this hurt?
No.
So the head is non-tender, and I don't feel any depression, any bulginess, any masses. So the head is normocephalic and atraumatic. All right, so that's very good. So now I'm looking at your eyes, and I'm gonna start with your eyelids. They're even. Your eyelashes are curled out. I don't see any swelling, redness on your eyelids. Your palpable fissures are symmetrical. You're able to blink. Can you please look to the side and look to the other side? Thank you very much. The medial and lateral canthus are pink. I'm looking at the sclera. It's white in color. And the conjunctiva, the palpable and bulbar, I do see some vessels. Very good. I'm looking at the cornea, which is shiny. The iris is dark, and I do see the pupil is also it's midline. All right. Okay, so I'm gonna go ahead and turn up the light because I'm gonna be checking for your red reflex as well as checking for your optic nerve being intact. Okay. So I'm gonna start with the reflex. I'm gonna start with the direct. Can you please close one of your eye? All right. As I shine the light. Okay, very good. Pupils constrict. To the other. Very good. Pupils constrict. You're gonna look at me. I'm gonna do the consensual. As I shine the light, I'm gonna look at this on the opposite eye. Very good. As I shine the light, I do see the constriction of the opposite eye. All right, and that's checking for the cranial nerve too. So I'm gonna go ahead and look behind your eyes, the vessels. I'm gonna go ahead and look at the vessels behind your eye. Okay, I'm gonna dial this to 0. Okay, very good. All right. So whatever I do on one eye, I'm gonna do on will be done on the other eye. Okay. All right. Just look straight at my shoulder, and I do see the red reflex. So I'm gonna follow to look for vessels. Very good. I do see the vessels. I don't see, and I do see the fundus, the optic disc, which is yellowish in color, and it has a sharp margin. I don't see any bulginess, any cupping, and I don't see nicking of the AV. All right, very good. I'm gonna go ahead and turn the light on. All right, so now what I'm also gonna do is I'm gonna check your peripheral field. Okay, you're gonna tell me yes when you see my fingers. Okay, yes, yes. No, you're gonna look at me.
Yes.
Okay,
Yes.
okay,
Yes.
okay,
Yes.
okay. Very good. Peripheral vision intact. I'm also gonna check for cranial nerve 3, 4, and 6, which is the oculomotor, trochlear, and the abducent, and that's checking for extraocular movement. So I need you to follow my hand, or I'm going to grab this pen, and I need you to follow. Okay? Very good. Okay, so that's intact, and it tells me the pupils are equal, round, and reactive to light and accommodation. Okay, so I'm gonna have you, if you can, please stand for me. I need to check your visual acuity. All right. So please tell me the smallest line you can read. Close one eye. Okay.
526 4793.
Okay, can you do the other eye?
526 4793.
Okay, very good. So the visual acuity is 20/20, meaning she can see at the 20th line when the normal person can see at 20 feet. Thank you very much. Please have a seat for me. All right. So now I'm gonna go ahead and check your. I'm gonna test for. I'm gonna go ahead and test for cranial nerve 5, which is the trigeminal. Okay. So first I'm gonna check your corneal reflex. All right. Okay. So that she blinks the eye. As I bring the cotton close to her. All right. So now I'm gonna have you close your eye, and you're gonna tell me what you feel, whether it's sharp or dull. Okay? Close your eyes for me. Dull. Sharp. Dull. Close your eyes. Sharp. Dull. Dull. Okay, very good. So now, continue with the trigeminal. I'm gonna palpate for your temporal and your masseter muscle strength, okay? So first I'm just gonna palpate here, okay? Now with the masseters, can you push against resistance? Thank you. Can you do the same here? Thank you. So while I'm here, I'm gonna go ahead and palpate for the temporal artery. It's palpable. I'm gonna go ahead and palpate your TMJ. Can you please open and close? Okay, no popping or clicking felt. All right. Okay. So now I'm looking at I might as well, I'm gonna go ahead and do the facial. Can you please frown for me, which is cranial nerve 7? Smile. Puff your cheeks for me. Okay, very good. So now I'm gonna go ahead, I'm gonna inspect your nose. Okay, I'm looking at the nose and it's midline over the nostrils. All right, I'm gonna go ahead and inspect. Up right here. Pardon me. Okay, as I go, I see some short hairs. I don't see any polyps, any lesions. It's patent, it's cleared. All right, I don't see any deviation of the septum. And the septum is pink, nice and pink, and the turbinate's pinkish as well. All right, so I'm gonna go ahead while I'm here and check for your cranial nerve 1, which is olfactory. You're gonna tell me what you smell. Please occlude one nose. What do you smell?
Feel.
Okay, occlude the other. Okay, very good. Thank you. All right. So cranial nerve 1 is intact. Okay, so now I'm gonna go ahead. I'm inspecting the lips. She's got makeup on, but the contours of the lips seem to be even. Can you please smile for me? I want to be able to see your teeth. Okay, so the teeth are white, and the gums are pink. All right. Now, can you open for me? Okay, thank you. All right. So I'm looking at I see at the bottom of the tongue, it's pink. Okay, can you please stick your tongue out for me? Okay, now the protrusion of the tongue will be cranial nerve 12, the hypoglossal. All right, I'm looking at the tongue. It's rough. The tongue is rough, but there are no white patches. The hard palate is hard and it has a rough edge, and the soft palate is pink. Can you please stick your tongue out and say ah? Okay, the uvula is midline and rises symmetrically. All right, I don't see any redness. The buccal mucosa is pink. All right, so by her saying ah and me checking, I'm checking for cranial nerve 9 and 10, which is the glossopharyngeal and the vagus. I'm also gonna check for gag reflex. Can you please stick your tongue out and say ah, so I can be able to? Okay, very good. Gag reflex is intact. All right, very good. So now I'm gonna go ahead and check. I'm gonna inspect your ear. So whatever I do on this side, I'm gonna do on the other side. I'm looking at the ear. I don't see, right with inspection, I don't see any swelling, any redness. I'm gonna palpate the helix. Any pain here? Okay. Any pain here? Tracks no. Any pain here? All right. Any pain? All right. And the external canal, as I said, was I don't see any redness. So now I'm gonna go ahead and do actually inspect the inside of the ear. All right. So pulling the ear up and back. I'm gonna go in. All right. It's patent. I do see the cerebellum a little bit. All right. The tympanic membrane is pearly gray. The cone of light is, I'd say, about 4 o'clock here. I do see the unborn short process. No perforation and no bulginess. Okay. Whatever I do on the right, I will do on the left. Okay. So now I'm gonna go ahead and I'm gonna go ahead and I'm gonna inspect your. I'm gonna feel for your lymph nodes. Okay. All right. Starting with your pre-auricular. Do you have any pain?
No.
All right. Post-auricular.
No.
Any pain? Occipital. Any pain?
No.
All right. Post-cervical. Any
No.
pain? All right. Anterior cervical.
No.
All right. Superficial.
No.
The deep chain.
No.
All right. Tonsillar.
No.
All right. Submandibular.
No.
Submental.
No.
Okay. Supraclavicular.
No.
All right. And I did not feel any nodules or any swelling. In supraclavicular, I did not feel yes. I did not feel any nodes or swelling. All right, very good. So now I'm gonna go ahead and I'm gonna check and I'm gonna go ahead and look as I'm looking at your throat to assess for your trachea. Your trachea up here is midline, and I'm gonna go behind you and feel for your thyroid gland. Okay. Can you please swallow for me? Very good. The thyroid gland up here is midline. Did not feel any swelling, any nodules. All right. So now I'm gonna go ahead and do assess your do a thoracic assessment. Okay. I'm gonna start from the back. I'm gonna start with the normal curvature. I'm gonna start with the curvature of the spine, starting from the cervical. The neck is concave. The thoracic is converse and concave. Sorry. All right, and the sacrum is concave. All right, so I'm gonna feel. Do you have any pain? I'm gonna palpate. Any pain? Okay, very good. So now I'm gonna check. I'm gonna palpate the back. I'm gonna palpate, the back, and it's for your lungs. If you can say 99 for me.
99.
Very good.
99.
Okay.
99.
Okay.
99.
Okay, very good. There were no hypervibrations in bilateral lungs. Okay. Now I'm gonna go ahead and percuss. Okay, did not hear any hyperresonance. The percussion was resonant, which is good. So now what I'm gonna do is I'm gonna check for your diaphragmatic excursion. Okay. Can you take a deep breath for me? And out. Okay, very good. While I'm here, I'll check for CVA tenderness. Any pain? Any pain?
No.
Okay, very good. So I'm gonna go ahead and percuss for the percuss for your diaphragmatic excursion. Okay. The first one was for the expansion. All right. Just breathe normal for me. All right, and I'm gonna measure. All right, take a deep breath and hold for me. Okay. Now measure. All right, and this is about 5 centimeters. Okay, now I'm gonna go ahead and listen. Just breathe normal for me. Okay, very good. Lungs are clear. Lungs are clear. No crackles, no wheezing. All right, so now I'm gonna go ahead while I'm there, and if you can you say E for me?
E.
Very good.
E.
Very good.
E. E.
Okay, so the gophony is intact. I'm gonna go ahead and do the bronchophony while I'm in front. E. Thank you. E. Very good. So now I'm gonna do the whisper pictoriloquy.
What's my name?
Okay, I barely heard whisper.
What's my name?
Okay, very good. So now I'm gonna go ahead, as I'm looking at the chest, I don't see any, asymmetric movement of the chest. It's symmetrical, the rise and fall is symmetrical. I don't see any use of accessory muscles, or any signs of distress. So I'm gonna go ahead and listen at the front as well. Okay. All right. Okay, very good. Lungs are clear. All right. I'm just gonna come here real quick. All right. Please shrug your shoulders, and that's checking for cranial nerve 11. That's intact. That's the spinal accessory. All right. Very good. So what I'm gonna do next now is I'm gonna listen or also take for the heart, the locations of the heart sounds. First is the aortic, which is on the right side at the second intercostal space. So I'm gonna look for the sternobody. And slightly. Just hold your breath for me. Very good. Now I'm gonna go to the left, second intercostal space, which will be checking for the pulmonic. All right, then I'm gonna slide to the third intercostal space, which will be checking for the tricuspid valve for any signs of any murmur. And then now I'm gonna come on the left to I'm checking for the pulse of maximal impulse, which will be at the fifth intercostal space on the left sternal. Okay, can you please lean forward for me? Thank you. All right. So now I'm gonna, with your carotid, can you please lay down for me as you continue? All right. I'm gonna cover your lower extremity for privacy. Yeah, just lift your feet for me. Thank you. All right. So whatever I do on the right side, I would do the same on the left. I'm gonna have you please turn your head over. Okay, so I'm able to see the pulsation of the carotid pulse. I'm gonna go all the way up, and I do see the jugular vein pressure as well. So I'm gonna go ahead and measure the JVP pressure. So the first ruler is gonna be at the sternal angle. Okay. Oh, sorry. Should be this way. right. All right, so I'm measuring about 4 centimeters for JVP, and that's normal. Okay, so while you're laying down, I'm gonna go ahead and assess your abdomen, okay? I'm gonna print this up for privacy. Thank you. So I'm looking at the abdomen. The abdomen is round. I don't see any scaphoid. Okay, I see some striae. All right. So I'm gonna go ahead and listen. In the fall. All right.
No.
Gonna start with the right lower quadrant. Okay. Usually you listen for 5 minutes in all 4 quadrants. So the sounds are all equal in all 4 quadrants, no hyperactivity and no hypo vowel sounds. Okay, so now I'm gonna go ahead and listen for the aortic, the arteries we can find. Gonna start with the aortic. All right, then now the renal. The iliac. And then the femoral. Okay, so while I'm here, I'm just gonna go ahead and palpate for the femoral, for the inguinal node. And the femoral, okay, and the femoral too. All right, very good. All right, so what I'm gonna do now is a light palpation. Okay, you let me know if you have any pain. Any pain? Any pain? Any pain? Any pain? Okay, now deep palpation. Any pain? Any pain? Any pain? Okay, any pain. All right, so I'm gonna go ahead and percuss for the liver expansion. That should have been done before the palpation. All right, I'm gonna try and locate the border. Okay. Okay. Does that hurt? Okay. Gonna measure. Gonna start here. And I'll measure. And that's about 6 centimeters. Okay. Now, if you can please roll to your left side while I palpate your pulse of maximal impulse as well. Okay, just lift this hand up. Okay, thank you. Right at the 5th intercostal. It's not always palpable in people, people that are okay. All right, thank you. All right. So while you're laying, please lay straight for me. All right. Gonna go ahead and And I'm gonna go ahead with your lower extremities here. They're even. Bilaterally, I don't see any swelling. The skin, I don't see no edema. It's palpable. I mean, no edema. I'm gonna go ahead and palpate for your pedal pulses. Very good. They're palpable. And your post-tibial. Palpable. Very good. So now I'm gonna do some reflexes with your hip. Okay. Can you please lift your leg for me? No, straighten it for me. Extend. Up. Pick it up. Don't curve. Don't bend your knee. Thank you. Up. Okay. All right. Up. Very good. And down. Can you bring it outward? Adduct. Okay. Abduct. Bring it close to your body. Okay. Can you okay. Externally rotate. Internally rotate. Thank you. Whatever I do on this side, I will do on the other side. All right. I'm gonna bring this back out. All right. I'm gonna have you sit up for me. Thank you. While you're sitting, I'm gonna check for your popliteal pulse. And it's palpable. All right. I'm gonna also here check for your reflexes. I'm gonna start with the Achilles. Okay, very good. The knee. Okay, thank you. I'm gonna do the brachial, the bicep. Okay, and the tricep. Okay, very good. What I'm also gonna do now is I'm gonna go ahead and assess your pulses. Okay, I'm gonna feel for them. All right, the brachials, palpable. And so is the radial. All right. So now I'm gonna have for the continuation, I'm gonna have. Can you please extend your arm for me? Thank you. And bring it outward. And bring it up for me. Okay. Very good. And can you rotate it for me? Very good. I'm checking for any rotator cuff tear. Can you bring your arm back? Very good. Combing your hair. Very good. And can you bring your arm close to you? Very good. All right. Can you bend your elbow? Extend for me. Okay, can you pronate? Supinate? Okay, now with your wrist, can you flex? Extend? Okay, can you ulnar deviation? Super deviation? Can you abduct your nails for me? Your fingers for me? Okay, and bring it closer. Okay, just bend your interphalangeal, okay, the proximal and the DIP. Okay, and then now addition. Okay, alternating. All right, very good. So now I'm gonna have you stand for me. Okay, so can you just follow my step? Heel to toe. Very good. All right, and can you stand and close your eyes for me? Okay, I don't see any swaying. All right, open your heel to shin. Okay, very good. All right, and point your finger to your nose. Okay, with your eyes closed, sorry. Okay, very good. Now, I'd just like you to have a seat. There was one more I did not do, which was checking for your hearing. And I'd like to do that. So I'm going to use the tuning fork. I want to check the hearing in both ears. Okay? So you're going to tell me when you okay. Okay, very good. Were you able to hear in both ears?
Yes.
Okay, so Hearing is intact in both ears. Now I'm gonna check for the Rhines test. Goes on the mastoid bone.
Yes.
Okay, and now back to the.
Yes.
Okay, very good. So that was the Rhines test, which was showing that the air conduction is greater than bone conduction. Okay. All right. So I think I'm all set.
Thank you.
You're welcome.